Roberto Murillo Jr. is 12 years old and suffers from type 1 diabetes. He injects himself with insulin 5 to 6 times a day. His parents, Veronica Macias and Roberto Murillo, are both unemployed, an example of a family hit hard by the economy, just trying to make ends meet to take care of their son's medical needs.
We live in Ecuador, my country, so he didn't have the adequate treatment over there, so we moved over here to America. I came here to Miami first, and then I heard about the clinic. And
Veronica is speaking about the University of Miami Pediatric Mobile Clinic, the clinic where Roberto has received medical attention free of charge since he was 5.
They checked him out, they gave me supplies and helped me a lot.
Roberto Murillo is one of the many uninsured children seen with the Pediatric Mobile Clinic, a refuge for families. Since 1992, the mobile clinic has been driving into the hearts of families in South Florida. The Big Blue Bus, as it is lovingly known by patients all over Miami-Dade County, provides health care at no cost. Medical Director of the PMC, Adrian Kaw, keeps the clinic's mission statement a priority.
Our goal is to provide high-quality, comprehensive primary health care for children from birth to 21 years of age, regardless of ability to pay.
The PMC provides all services a patient undergoes in a private practice, plus social work, mental health counseling, and psychology. The best part is this healthcare help comes on wheels. The clinic reaches all over Dade County, going deeper and covering more ground than any other clinic. And the miles traveled are not the only proof of how far this clinic will go.
A lot of our patients have very special healthcare needs where if we weren't here, they would have to pay for all the doctor's visits, the medicines, the supplies out of pocket.
If a patient needs further care from a specialist, the PMC will also refer to a wide network of community partners. 11-year-old Sharon Morras is one of these patients with very unique needs. This is her mother, Rosa Centeno, who brought a very sick Sharon to the United States from Nicaragua. I came to this country because I have a child with problems, many medical problems. At the clinic, they discovered that she has a syndrome that has affected all of her organs. I am very grateful to the mobile clinic, which has been the most important resource God has used to help me with Sharon. Sharon Morras was diagnosed with DiGeorge syndrome. As a result, she was born with heart problems, severe scoliosis, and has learning and developmental disabilities in combination with several other health problems. Licensed mental health counselor and social worker on the PMC staff, Gladys Campa, has been working with Sharon for several years, helping her receive multiple spinal surgeries. She has also been able to refer Sharon for ear surgeries, speech therapy, and dental services.
This child who used to be very petite, and you know her shoulders were curved because of the scoliosis. You see how she has grown and she has gained weight and she looked much better.
Dr. Michelle Floyd is one of the pediatricians of the clinic that has been working closely with Sharon.
We've noticed she's much taller, she seems more confident. Now instead of being underweight, we're actually worried that she's getting to a little overweight, but she's really swung to the opposite end of the spectrum. And this has been a long process. It's not something that happened from one day to the next by any means, but it's been a process that we all have been really involved in.
Sharon's 16-year-old brother, Marlon Morras, is also a patient of the mobile clinic and expresses his gratitude for the existence of this nonprofit organization.
My experience with the mobile clinic has been great. I mean, it has been one of the most positive forces I've encountered in this country.
Sergio Correa is another child that has witnessed the miracle of help through the mobile clinic. At 5 months old, Sergio suffered from a severe fever that paralyzed the left side of his brain. His mother, Lesbia Membreño, does not work because she devotes all her time to Sergio. Her husband works, but living in a single-income household is not enough to afford insurance. Through the PMC, Sergio receives everything he needs for his condition. Lesbia is saying that Sergio has gone through many positive changes since the mobile clinic has referred him out to other organizations. With the help of the PMC staff, Sergio undergoes physical therapy and now has a walker and a bicycle to stimulate muscle movement and exercise.
This child who came to our clinic in a little stroller, he was at that time kind of 10 years old. And we have worked with him so much that he has been able even now to ride his special bike.
This clinic's unique staff makes it possible to go above and beyond to accommodate patient needs.
We're very fortunate to have a social worker that works with us and a part-time psychologist, which really makes a big difference, because there are a lot of issues that families have that could include anything from, getting insurance for their children if they qualify, to helping them with resources such as food or clothing.
The Pediatric Mobile Clinic has 2 pediatricians, a licensed mental health counselor who is also a social worker, a psychologist, nurse practitioner, and a medical assistant. There are 2 mobile clinic drivers who also do patient registration at the sites. residents and students also rotate to volunteer with the clinic. Aside from its field staff, the clinic also has employees at the PMC office on the medical campus working on administration and funding. The University of Miami Pediatric Mobile Clinic receives funding from the Children's Health Fund and other organizations. They are looking to expand to meet the growing need and are seeking more support.
We'd like to expand the team. Right now we're at full capacities, and we're looking more for funding from foundations, from companies, from individual donors.
About 2,000 patients a year are seen with the mobile clinic, all receiving health care because they have no insurance. These patients represent a portion of the 21% of uninsured children in Miami-Dade County. A Census Bureau report shows Florida ranks number 3 among the states with the highest percent of uninsured residents. In Miami-Dade County, about 122,000 children are uninsured, meaning that aside from the 2,000 patients seen at the PMC, about 120,000 could be lacking any type of medical care, and that number is increasing.
We've seen in the last 2 years a big increase in people that are working middle-class families that have recently lost their insurance, therefore they've lost access to health care.
Ed Harari is a resident of Coconut Grove who has pay-as-you-go insurance. He was curious about coming to the mobile clinic after seeing his insurance increase from 10 to 15%.
The staff at the clinic, on site is fabulous. The first time I went with Leo, I was very impressed. We met with a psychologist as well as 2 different doctors, and they brought me through the developmental milestones of where Leo, my younger son, should have been.
Taking his son to the PMC saved Ed over $700 in vaccination fees. The clinic makes sure all of its patients are up to date with vaccines.
When I came to this country, I was not able to get into the education system because I was missing many of the shots and health requirements that the country demanded from me. But the clinic helped me to get those shots done, to get my medical records in order.
PMC patients and their families depend on this service and are speaking up to voice their needs. I ask those that fund the clinic to continue supporting the clinic. The more help they receive, the more they help us.
If you really want to help the community, if you really want to help families that are in dire need, please continue to support this clinic.
And as long as there is a need for health care in the community, the Pediatric Mobile Clinic will continue to serve.
It's a very good feeling. It's very gratifying when you're able to change someone's life.